Hello, I'm Dr. Joseph Butler. I'm a geriatric physician, and for many years I have dedicated my medical practice to caring for adults over the age of 60, especially when it comes to brain health, memory, and cognitive aging. Today, I want to talk to you about something that causes a great deal of fear, anxiety, and often unnecessary distress among older adults and their families. Memory loss. One of the most common sentences I hear in my office is this: "Doctor, I'm forgetting things. Does this mean I have Alzheimer's?" That concern is completely understandable. Alzheimer's disease and other forms of dementia are frightening diagnoses, and awareness around them has grown significantly over the past few decades. But as a physician, my responsibility is not to jump to conclusions. My responsibility is to evaluate carefully, calmly, and scientifically. And one of the most important things I want you to understand is this: not all memory loss in older adults is dementia. In fact, many cases of forgetfulness have causes that are far more common, far less serious, and most importantly, reversible. One of those causes is dehydration. This may sound surprising, but from a medical and physiological standpoint, it makes perfect sense. The human brain is composed of approximately 75% water. Water is essential for maintaining blood flow, delivering oxygen and nutrients, regulating electrolytes, and allowing neurons to communicate efficiently. When the body becomes dehydrated, even mildly, brain function begins to suffer. Scientific studies consistently show that dehydration can impair attention, processing speed, executive function, and short-term memory. In older adults, these effects are often more pronounced. What appears to be early dementia may, in reality, be the brain struggling to function without adequate hydration. As we age, several natural physiological changes increase the risk of dehydration. One of the most important is a reduced sensation of thirst. The thirst mechanism becomes less sensitive over time, meaning older adults may not feel thirsty even when their bodies already need fluids. At the same time, total body water decreases with age. Muscle mass naturally declines, and muscle tissue is one of the body's main reservoirs of water. Kidney function also changes, affecting how efficiently the body conserves fluids. Many older adults take medications such as diuretics, blood pressure medications, or laxatives, all of which increase fluid loss. There are also behavioral factors. Some older adults limit fluid intake because they are concerned about frequent urination, nighttime bathroom trips, or urinary incontinence. Others replace water with coffee, soda, or other beverages that may contribute to dehydration. The result is that dehydration becomes extremely common after the age of 60, yet it often goes unnoticed. From a clinical perspective, dehydration can produce symptoms that closely resemble cognitive decline. Patients may experience difficulty concentrating, slower thinking, confusion, irritability, and frequent memory lapses. They may forget recent conversations, misplace everyday objects, or struggle to focus on simple tasks. These symptoms often fluctuate throughout the day. Someone may seem sharp in the morning and noticeably more confused later in the afternoon, especially in hot weather or after physical activity. This fluctuation is an important clinical clue because neurodegenerative conditions like Alzheimer's disease tend to progress gradually and consistently, not suddenly or variably. Another critical difference is reversibility. When memory problems are caused by dehydration, cognitive function often improves once proper hydration is restored. In my practice, I have seen many patients experience clearer thinking, better focus, and improved memory simply by increasing their daily fluid intake. This does not mean that every case of memory loss is due to dehydration. Dementia is real, and it should always be taken seriously. But dehydration is one of the first and most important reversible causes that must be evaluated before assuming a permanent neurological condition. On a physiological level, Dehydration affects the brain in several ways. Reduced fluid levels decrease blood volume, which lowers cerebral blood flow. This means the brain receives less oxygen and fewer nutrients. Electrolyte imbalances, particularly involving sodium and potassium, can interfere with nerve signaling. Stress hormones, such as cortisol, may increase, further impairing memory and concentration. Older brains have less physiological reserve, meaning they are less able to compensate for these changes. What might cause mild fatigue in a younger adult can cause noticeable confusion in an older one. Clinically, dehydration-related cognitive symptoms are often accompanied by other subtle signs, such as dark-colored urine, reduced urine output, dry mouth, dry skin, dizziness when standing, headaches, fatigue, and increased sleepiness. Unfortunately, these symptoms are often dismissed as normal aging, which they are not. In geriatric medicine, we are trained to look first for reversible causes of cognitive impairment. These include dehydration, infections, medication side effects, vitamin deficiencies, sleep disturbances, depression, and metabolic imbalances. Correcting these factors can dramatically improve quality of life. Alzheimer's disease, by contrast, is a progressive neurodegenerative disorder characterized by ongoing neuronal loss, accumulation of abnormal proteins in the brain, and gradual decline in memory, language, and decision-making. It does not improve with hydration, rest, or simple lifestyle changes. Confusing temporary cognitive impairment with dementia can lead to unnecessary fear, emotional distress, and inappropriate treatment. That is why careful evaluation is so important. From a preventive standpoint, maintaining adequate hydration is one of the simplest and most effective ways to support brain health later in life. While individual needs vary, most older adults benefit from consuming approximately 1.5 to 2 liters of fluid per day, unless advised otherwise by a physician. Fluids should be consumed regularly throughout the day, rather than all at once. Water is ideal, but herbal teas, clear broths, and water-rich foods can also contribute. It is important not to wait until you feel thirsty, because thirst is a delayed signal in older adults. I often advise my patients to associate drinking fluids with daily routines, a glass of water when waking up, another with meals, and small amounts between meals can make a meaningful difference. Keeping water visible and accessible is a simple but powerful strategy. Family members and caregivers also play an important role. If an older loved one seems more forgetful or confused than usual, one of the first things to consider is hydration. Scientific research continues to support the connection between hydration status and cognitive performance. Even mild dehydration has been shown to impair working memory, attention, and mental clarity, and these effects are often reversible within hours or days once fluids are restored. As a geriatrician, I want to emphasize this clearly. Simple does not mean unimportant. In older adults, basic physiological needs often have profound effects on complex systems like the brain. If you are experiencing new or worsening memory problems, it is essential to consult a healthcare professional for a proper evaluation. At the same time, do not underestimate the power of simple interventions. I have seen patients regain confidence, independence, and mental clarity by correcting hydration alone. Forgetfulness does not automatically mean Alzheimer's disease. Memory lapses are not always a sign of permanent brain damage. In many cases, the brain is simply asking for support. Caring for your brain starts with caring for your body. Adequate hydration is one of the most accessible, effective, and overlooked ways to protect cognitive function as we age. Before we finish, I want to leave you with a simple invitation. If this video helped you understand your memory better or brought you clarity and peace of mind, I encourage you to subscribe to this channel. Here, my goal is to share reliable, science-based information focused on healthy aging, brain health, and quality of life after 60. If this message was valuable to you, please give this video a like. That small action helps this information reach more people who may be worried, confused, or afraid about their memory. And I would really like to hear from you. Leave a comment below and tell me, have you ever experienced moments of forgetfulness that made you worried? Have you ever noticed improvement when you drank more water or took better care of yourself? I read the comments whenever possible, and your experience may help someone else who is going through the same situation. Thank you for trusting me with your time and your health. Take care of your body. Take care of your mind. And remember, growing older does not mean losing control over your health. I'll see you in the next video.
Join us on Healthcare Seniors.
Be part of our community and watch the next video.